Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. Today's show is called Dr. Jeffrey Tauth Sleep's Hidden Impact on Your Heart, and trust me, it's juicier than your cousin's peach cobbler. You know what drives me absolutely crazy? I see patients all the time who are doing everything quote-unquote right for their hearts. They're hitting the gym like Rocky training for Apollo Creed, eating more kale than a health food store, and their cholesterol numbers look prettier than a sunset. But their heart is still throwing tantrums like a toddler at Target. What's the deal? Well, the hidden culprit might be happening every single night while you think you're being healthy by getting your beauty sleep. Here's the thing that'll make your jaw hit the floor. Poor sleep increases your heart disease risk by 48%. Yep, entirely true. I can't make this stuff up. When you're getting less than 6 hours of shut-eye every night, you're basically rolling out the red carpet for a high blood pressure and inflammation to waltz right into your cardiovascular system. Sleep deprivation triggers stress hormones that damage your arteries like a wrecking ball going through tissue paper. As a cardiologist, I'm telling you straight up that sleep is just as important as diet and exercise for your heart health. It's the holy trinity, people. So what exactly happens when you're tossing and turning like a fish out of water? Your heart rate stays jacked up instead of dropping 10 to 15% like it's supposed to during rest. Think of it this way, your heart is supposed to be chilling on a hammock at night, but instead it's stuck doing jumping jacks and combat boots. Your body starts cranking out more cortisol than a stressed-out college student during finals week, and all that stress hormone increases plaque buildup in your arteries. Meanwhile, your blood sugar regulation goes haywire, putting even more stress on your cardiovascular system. And here's the kicker, those beautiful repair mechanisms that are supposed to fix all the daily wear and tear on your heart. They get disrupted like a construction crew that keeps getting their tools stolen. Now listen up, because this is where it gets really interesting. It's not just about quantity, it's about quality too. Those deep sleep phases are when your heart truly recovers and does its happy dance. When your sleep gets interrupted more than a politician giving a speech, it prevents those restorative REM cycles that your heart desperately needs. And don't even get me started on sleep apnea. That creates oxygen drops that strain your heart worse than trying to bench press a pickup truck. The beautiful thing is, when you maintain a consistent sleep schedule, it actually regulates your heart rhythm naturally like a perfectly tuned orchestra. Let me tell you about my patient Sarah. 45 years old, exercised daily like she was training for the Olympics, ate so perfectly that nutritionists would weep tears of joy, but she had high blood pressure that was more stubborn than a mule in mud. I was scratching my head like a confused monkey until we did a sleep study. Turns out she was waking up 23 times per hour from mild sleep apnea. 23 times. That's like trying to watch a movie while someone keeps hitting the pause button every 2 minutes. After we got her set up with CPAP therapy, her blood pressure normalized within 8 weeks without changing a single medication. Maybe I should see you in the clinic. We need to talk. Here's what I want you to do tonight. Set a consistent bedtime and stick to it like glue. Keep your bedroom cooler than a penguin's backyard and darker than my coffee. Aim for 7 to 8 hours of quality sleep, not just lying there counting sheep until they file a restraining order. And if you're snoring loud enough to wake the neighbors 3 houses down, or if you feel more tired than a parent of triplets despite getting adequate sleep, march yourself to your doctor and ask about a sleep study. Your heart will thank you more than a kid thanks grandma for cookies, and you'll feel better than a lottery winner on Christmas morning. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.